Good evening and welcome to Quinnipiac University and our Center for Medicine, Nursing, and Health Sciences. We're very proud to be hosting this important forum on healing healthcare. At the School of Nursing, we believe that every patient deserves a great nurse, and we're working very hard with our colleagues in medicine and the health professions to be able to provide a different kind and transformative learning experience here.
We're striving for a healthcare system that serves the people of this state and that is in alignment with our values that healthcare is a fundamental right. We are committed to promoting systemic change that addresses root causes and promotes solutions that work for all residents. We're so glad to welcome Shannon Brownlee, Senior Vice President of the Lown Institute and well-known author and health policy expert, to Connecticut this evening. She will deliver this evening's keynote address.
As many of you know, I've been obsessed with one particular aspect of healthcare reform, overtreatment. You can call it overuse, overdiagnosis, whatever you call it. We deliver a vast amount of medical service that patients don't need, that doesn't benefit them, that they don't want or they wouldn't want if they understood better what the trade-offs are. Overuse has arrived. At least 2 medical journals, the BMJ and JAMA Internal Medicine, have devoted sections to case vignettes and articles on the topic of overuse. We must face squarely the overuse, underuse, and misuse that is built into the DNA of our system and resolve to transform it.
We are immersed in a culture where overtreatment is exalted, where uncertainty is to be banished. Even if that's impossible, where we have to do something. So the culture of medicine that we've been inculcating in the medical education system, I think, is what's largely responsible. Universal health care. Why is what Shannon said so important? It's so important because our goal should be that every person in this country has access to quality, affordable health care.
I know nothing of reimbursement rates except facts like Medicare reimburses worker bees like me at 75% of what they will reimburse a physician for catching the same baby under the same circumstances. And I think the Affordable Care Act is a positive move in a positive direction, but it comes with more issues. All groups are not mandated to participate. And so while you have people now having access to insurance and health care more so than they did before, where do they go to get it? They're trying to affect some change, but it's from the bottom up. So they're working on us, all the worker bees, but what about from the top down?
Healthcare costs can't be separated from care, vice versa. These things are all tied together. Increasing healthcare costs are a result of lots of problems in the system. They also drive maybe less quality care, in my opinion. What we have come to witness lately over the last few years is such escalating costs and lack of transparency in the healthcare environment that it's becoming untenable.
It's time now to really hear from you. This is intended to be a conversation.
I want to know what everybody's experience is. When I talk about primary prevention, I'm talking about facts. 60 to 70% of all disease, including cancer, can be stopped before it ever happens. Why don't we make that the hallmark? I'm talking about everything, educationally. Why doesn't that run the whole process?
You're talking about these socioeconomic determinants of health, if I'm understanding you correctly. Until we acknowledge that these are the true drivers of health, the most important drivers, and decide that it is the right thing to do as a nation to take care of people, we're not going to be able to make a dent in disease.
We can't do the things that we should be doing as a society if those funds are being put into wasted, unnecessary, ineffective medical care.
I want to ask a question about something that was briefly mentioned, which is this business about a lot of doctors don't accept Medicare. So what good is the government giving us health care if
no one will take it?
Can't take it.
My comment about it's not fair that, you know, a certain few practices and basically it's out of the kindness of their hearts are accepting these patients, and I think that there needs to be, I hate to legislate everything. You would think people would just be honorable.
The employers have a big say. So if you can get the employers involved, they can push back a lot. They also tend to care about their employees and want the best for their employees. And I just think employers can make a bigger difference than they're making right now, and we need to get them more engaged.